Is there life after failing or flunking out of a medical program or a program in health care or a program in allied health or a program in complementary medicine or integrative medicine? Well, yes, there is, of course. But I understand the pain of the process. You have to get back on the horse, and you have to basically study another program, knowing that the program you flunked out of, or didn't like, or just didn't have any interest in and dropped, or didn't do well at, that program was not for you. You'll have to study another program. Now, I took Chinese medicine from 3 different schools. I would not recommend this. If there is a problem with the first school, there will be a problem throughout. I would suggest you choose a school wisely and only change schools if there is a very good reason for that. Not that the academics would be better or something, because that's just that's an excuse, right, for change. Because when I was in the first Chinese medicine program and made the assumption that and other people were involved, so there is also the being swayed by people's opinions, by people's market share, by people's attempt to get you to move to another school, and their biases. When I changed to the school in San Francisco versus the school in Sunnyvale for acupuncture, and the school in Sunnyvale is one of the cheapest programs in the United States, that kind of thing was used as a pitch to get me to try the other school. It was actually a naturopathic doctor who teaches at the other school that encouraged me to switch. Things were going pretty good. I was not aware that when I moved to San Francisco subsequently, my income on Lyft and Uber would greatly decrease, not realizing that outside of the valley, when you go into San Francisco, your fares are much shorter. So you would think, yeah, there's more volume and more business, sure, but the fares are much shorter. I think there has been labor reform with Lyft and Uber since, but I haven't been able to make an income doing that in Seattle or anywhere since. But I was making about $400 regularly in the valley, and that was enough to subsist on because my room rent was about $750. There wasn't many other costs. Now in California, roommates really do want you to eat outside of the house. They really only provide limited cooking facilities in most cases because of the cockroaches. I hadn't known this, and I was cooking a lot more than normally would be allowed. So just so you know about that, because there are a lot of medical programs in the San Francisco Bay Area, including acupuncture. But I understand the pain and the frustration when the faculty comes to you and says, we've identified you as kind of a risk to the community, and you can't take any of the practical classes. At best, what we could do is you could have sort of a theory-based degree, and you could sort of get an academic degree that wouldn't allow you to practice acupuncture because we wouldn't reflect you having any treatment hours, and we would sort of give you a master's, but you wouldn't expect to pass the exam because we would make it clear that you only studied theory And I understand what it is when the whole school is, for some reason, aligned against you. And this particular school, the third school I went to, closer to here, in Seattle, I believe had a mafia problem. I believe that the students recently enrolled and perhaps currently enrolled are in some affiliation and kicked me out. But that's a funny thing to believe because during my time there, I was convalescing from mental treatment. I wouldn't say mental disorder, because when I do look at the DSM now, I don't think I had one. I was recovering from mental treatment, possibly disorder, but to me, the disorders were derived from drugs prescribed me that I was required to be on. So essentially, the disorders were resulted in from prescription medications and their side effects. So having said that, do you really want to go down that path of medicine, allopathic medicine, which does that to people? That's the first question. Second question is, what program are you in? Like medical school? Well, that's quite challenging. Even Chinese medicine, which in a lot of cases people believe is synonymous with regular allopathic medicine in some ways and makes you a care provider, right? Well, even that is a very difficult program. Nursing is probably the most difficult, I would think. It is the most hands-on and involved, and I believe that nurses do the bulk of the work when it comes to healthcare. And for that reason, I sometimes like physician associates or nurse practitioners better than MDs. And I used to think that DOs were really cool, but they don't use any of their skeletal manipulation skills most often, so they're really just synonymous with doctors, medical doctors. Now, for the most part, as they use their degree, unless they advertise that they do the manipulations or the treatments that go with osteopathy. But for me, after 3 attempts to do TCM, I moved on to mental health. So I'm studying for my marriage and family therapy degree. It's an online program. It sounds kind of like a joke if considered in comparison with schools like, Tufts, Harvard, Johns Hopkins, Stanford, etc. But really, I'm going to have clinical skills. I'll be eligible to work as a hospitalist if I wish to, but I don't wish to. I wish to keep my practice separate from medicine, I think. But there are people who specialize in medical marriage and family therapy and medical therapy, which means that they sort of help the patient through their treatments. They're sort of a liaison. They sort of help them know what to expect, and they just give them support as you would have for various conditions. So, I fell off the horse, and a couple years later, about 1 year later, got back on, taking more debt, taking a little bit of a risk since I had been let go of from one program. And yes, it looks like kind of a joke academically. You could say that it is, because there's no actual lecture, and it's a kind of experimental program now in terms of there's very little reading, but there's weekly reading and there's weekly essays, and in these essays, as many as 12 pages long and written in APA format, I've sort of built confidence and found that I'm getting to where I feel is the sort of the professional level, graduate level, etc. And I see on the horizon that in a couple of years, with my clinical done, I'll be licensed to do this, and I'll be making upwards of 100K, doing a mental health specialty, psychotherapy, helping people with their problems and relational problems, particularly as they relate to the family, with a systemic orientation, which is what this program looks at. This I feel, is a very suitable program for becoming academic with hypnosis and hypnotherapy. I have chosen not to predecess my studies in marriage and family therapy with a program in hypnosis. I hope to train with people at the graduate level when I do this, but even if I don't, even if I have, or even if my trainer just has a PhD, which might look kind of dubious or phony or might not be accredited, or the PhD from the University of Manoa, Hawaii, which I feel is very good in hypnosis and psychology PhD, and it focuses on hypnosis and cognitive therapy. So I would respect them, if they had that. But I've been holding off on training because I don't just want to be a run-of-the-mill hypnotist. I could have done that out of high school. I could have trained for a couple $1,000, taking a kind of hokey course, and would have been a professional hypnotist. I could have hung a shingle right away. It wasn't very common starting out in 2003, 2004. It wasn't so common in the world. So I essentially could have done that. I chose to take a much longer route. Came back to school a lot later, so I don't have many years left in terms of career development. So I want to be done. Could get a PhD in the field I'm looking at, the current field, or a similar one. And I want to be done. Or I could get this current master's degree and maybe a master's of science in nursing, the MSN Direct Track program, where you don't have to go through the RN and you are an RN, but you don't go through the undergraduate 4-year degree, the BSN, right? And I'm also thinking maybe MA, because PA. So I'm thinking PA, or maybe a nurse, and those are both master's tracks that get you in a similar footing, in a similar place. So if you have fallen off the boat of like medicine, let's say medical school, then you can choose one of those tracks. And really, at the end of the day, you're essentially going to feel that, well, you might be paid less, essentially, than you would otherwise be paid, maybe. You're still doing healthcare. You're still in the field. You're still kind of doing what you wanted to do. You just sort of might have taken a longer approach. So I would say if this is you, there is a recovery phase. It's kind of like a mental illness to recover from when you get shot down like that and when you fall down like that. But it can be helped with therapy. Of course, I would say that. And of course, there are psychopharmaceuticals that could be helpful to you in recovery and whatnot, depending on what your whatever condition is. And so you can always get evaluated for that. But really, I find that when you lose your place in a medical-based program or anything like that, if I have anything to say about it being in the complementary medical field, a lot of people would think I was a pseudoscientist at best, that my program was not even anything and that I am a bigger loser than them. So at least you have that. If you did come out of a medical program, then yeah, there are bigger losers than you, such as myself. Okay, granted. But those kinds of categorizations and labels are also pretty much mistaken as well. So you may want to evaluate those labels, especially if they keep you back. And now the question is, essentially, now what? Of course, people are going to pressure you to pay your loans. They may even pressure you to get some type of employment which you cannot stand. Just to pay loans, I would not recommend this. I would recommend actually the opposite, staying on the treadmill, staying on the track long term until that master's degree is on the wall with your other degree, or that PhD, if it is one of those unique programs that doesn't require a master's, which is quite unusual now. So, in order to get rid of, excuse me, that debt, you may wish to get a fully funded program, like an MBA, because oftentimes the master's degrees that are handed out are like business or various things, whatever they need, whatever is in demand. It may not be something that you're interested in focusing on, but you may be able to express enough interest in it in order to succeed in those programs, which don't cost any extra tuition, which usually have a stipend. I mean, if they're fully funded, they would have a stipend. There would be a teaching fellowship potentially. Sometimes you get the stipend without a teaching fellowship. Just you get the stipend if it's the right program. So from here, that's what I would do. That's how I would pay off the debt, by still achieving a credential, still getting somewhere. You may have shot for the stars and gotten to the moon. You may have shot for the moon and landed amongst the stars, is what I mean. So, you still have potential. You still have a place to go. You still have a direction. You just need to reinvent yourself and see why the program that you were in didn't work out. Excuse me. Maybe for me, I didn't have the physical agility or acuity. I hadn't tested that out to a great degree. I wanted to believe that I could develop it. But a lot of the time, if you're not good with your hands, you just simply won't be. And usually you'll know if you're good with your hands. Usually you've been led to do tactical things all your life. So what I'm studying now, just like what I studied in undergrad, is still in the same lane, is in the humanities, and deals with intellect and feelings, and doesn't so much deal with physical tasks. If I was to take blood, I might end up being exactly like that guy from Australia on TED Talks who became an Indian guru in the tradition of Hinduism, or or he became a Sikh. Basically, he became a Sikh and a yogi. I guess he calls himself that, a yogi, and got away from allopathic medicine because he failed the practical, or was practicing and ruptured a patient's blood vessel, and it was an old lady, and totally injured her. So at least, hopefully, you didn't hit that level. I mean, even if you did, well, you can become a yogi and stuff like that. So I understand your frustration, your pain, your experience from this. If you were to get any master's degree that wasn't on the list of fully funded programs, like the one I'm doing, you might have to work full time. And that usually means that 9 times out of 10, you had a shitty undergrad program, but didn't teach you anything and doesn't provide you with any leads for employment, and people look down upon. So if it takes that, if it takes being a security guard, customer service, things like that, and even driving a cab or something like that, well, been there, done that, still there. That's what I have to say about that. You might have to do that. And it's really humiliating if you fell off the medical wagon to all of a sudden be doing that. But you have to remember that nurses, doctors in real life really are working class people, really do things that aren't that different from what you've been doing in some ways, a lot of the time, just the practical work of maintaining a hospital, a hospice, a ward, whatever it is, a clinic, whatever it is. And at the end of the day, do you really want their job more than yours? It does pay. Yeah, sure. It does. It is better. Yeah, they always say. But at the end of the day, you got to value yourself where you are. You got to value that GED version of yourself, the loser version of yourself, the version of yourself that, is your patient, is your general patient in general real life situations. It could otherwise be you get the nursing degree, you get the doctorate, you end up being employed by Concentra. Most of your clients are there for vocational medicine or whatever they call it, and they're there for their drug tests and their physical and stuff like that for employment purposes. And so it ends up being that neither side is better than the other, right? So that you end up most of the time working for the working class anyway, right? So especially if you're born working class, and usually you can't get out of it a lot of the time. So, because it's a very classist society today, and stuff like that. A law degree, a business degree, that can also potentially help you out of the rat race if you are interested in doing that more than you have interest in a medical field. Without any other examples of more pressing matters, such as I would help with in my counseling and later therapy, I don't have anything else to recommend. If you do find yourself in these situations, and you're a Washington state resident or perhaps live in other countries, you can visit us at bluebuddhadta.org, which stands for, did I get that? Yeah, Dharma and Tao Association.org, DTA.org. You could visit us there and arrange counseling with me, and we can talk about this face-to-face with Doxy, and we can help you see where to go from here. Other than that, that without any further examples of what you're actually going through, that's my best general advice on the matter. Thank you.